Hi, Diane Goodmanson, Nurse Practitioner here. I'm back again to provide some answers to some common questions that we're getting asked as we're out and about providing services as a nurse practitioner. And also, I've been getting the same question through our Facebook page and social media, as well as even Instagram and LinkedIn. The question that I've been getting asked the most commonly is, what exactly is a nurse practitioner anyways? And so people are confused because we have the word nurse in our title, and yet we do a lot of things that typically a doctor would do. And so there seems to be a fair bit of confusion about what exactly is a nurse practitioner and how does this role fit into our healthcare system. So this question I've answered numerous times, so I'll try to keep it concise. So a nurse practitioner is a nurse who has taken advanced education and training and now is a nurse practitioner. And so this education and training involves learning about how to provide medical care to patients. And this role has evolved quite a lot since I first started practicing in 2003. When I first started, a nurse practitioner could do approximately about 70 or 80% of what a family doctor could do. This would be prescribing medications, ordering diagnostic testing, but there was some limitations back then in terms of what we could prescribe, what forms we could complete, and how we were recognized in the healthcare system as a whole. And so over time, we became independently licensed in 2006. And I would say the role has progressed rapidly since that time, which is, in the last, especially in the last 10 years. And the role has progressed significantly to the point where now when you see a nurse practitioner, if you look at the scope or what we can offer in terms of medical care, you would hardly know the difference between what we can provide and, let's say, what a family doctor can provide for a patient. And so this role, the biggest differences between the role of nurse practitioner, let's say, and family doctor, you can't even really compare them, because as a nurse, we're trained initially as a nurse. So that would be, things like therapeutic communication, the caring aspect, and, providing patient care from the heart and being an advocate, and all of these very powerful things that we would bring to our care as a nurse. And so now when we take that role and move it into the medical realm, we also bring that way of thinking as a nurse, the therapeutic communication, the holistic approach, and working as a patient advocate. We bring all of those things into the care as we provide it for patients. So if you have a patient coming to see us, or we go and do a house call to see somebody for, let's say, a chest infection or a skin infection or something like that, the holistic approach would bring in the patient environment. So it could be like their social situation, maybe their finances, or sort of their nutrition, or the other aspects that have an impact on their health, maybe that would contribute to the root cause of why they had that infection in the first place. For example, are they a smoker? Are they kind of doing things, or kind of, their lifestyle does not support healthy circulation, which is what's giving them, a poor circulation to begin with, which is then leading to a skin infection. So that holistic approach looks at so many multiple factors that contribute to the problem. That's very, very different than if you go to a regular clinic and have a skin infection diagnosed and get your antibiotics, and then away you go. And so the fact that we can offer more time and more sort of a different look at things makes us completely unique. So this is why you can't really compare us to, let's say, the family doctor, although some people do compare us, because our approach is completely different. Like I said, we've come at things with the approach of a nurse, and look at things naturally from a more holistic approach, looking at multiple factors and identifying root causes. So that's where the approach and the kind of care that you get from a nurse practitioner is far different, because even though in the end you may have an antibiotic of some kind to treat the problem, there is so much more that we bring to the clinical encounter that's beyond just identifying the problem and then providing the treatment. So it's complex, but just understanding that there's more to the care than you'd think, kind of identifies how nurse practitioners are far different in terms of the way we approach patients. So today, now you're going to see nurse practitioners out there providing urgent care, providing some walk-in services like at the quick care clinics, and there's numerous nurse practitioners now that are moving into independent practice where we're offering services on the go, such as house call services. Sometimes we have specialty clinics, special kinds of services that we offer, and sometimes pain management, and even things like de-prescribing programs. Like the de-prescribing programs that we put into place are, hey, let's do a very thorough assessment of this patient and say, okay, do you really need to be on all of these medications? And it's really, the philosophy is, let's find the lowest effective dose of medications that you need, and then provide the care based on that. Because, if you're on a lot of medications, you tend to have an awful lot of side effects and complications, and then we're treating the side effect of one medication with another medication, and it just ends up being this massive list. And so we're doing a lot of work with de-prescribing, especially for elderly, and also for people that have been on chronic pain medications for years, trying to find the lowest effective dose of perhaps maybe the opiate that they're on, or finding better solutions for that pain management outside of just the opiate. Like, for example, cannabis. We're exploring, we do offer medical cannabis as an option, and also we work collaboratively with specialists to try to find the best, in terms of pain management for patients. So those are just some of the things that we're working on through NP on Wheels as nurse practitioners, and the way that we fit into the healthcare system is maybe hard to understand in some ways, but we offer a service that helps to fill the gaps that we identify. So people that have been frustrated with the healthcare system, maybe not getting the kind of care that they want, or let's say their needs are far more complex than maybe a short clinic visit can manage. And so we have options where people can, have a much longer visit, so we can really get to the root of problems and provide the kind of care those complicated patients need. And the other thing is we're doing is we can provide services for patients who have special needs, and we can provide them at the home, so it's far less stressful and at times far more effective than trying to manage them, let's say, in a clinic setting. And we do we do way more than just that, because we provide services for all ages at both our clinic sites as well as house calls. And so anyways, as nurse practitioners, the main question is, what is a nurse practitioner? And so hopefully I've, in a roundabout way, answered that question so that you see that we're an advanced practice nurse who provides medical care, including medication prescribing, ordering diagnostic tests, doing diagnoses, and also working collaboratively with specialty care as well, to provide a thorough service for patients, and you could choose to have a nurse practitioner as your primary care provider instead of having a doctor nowadays in the system. So it's just another option for care that has a different approach, a very unique, holistic way to provide medical care, which makes us far unique and different. And some patients have a preference for that type of approach to care. So hopefully that answers your question. I'll talk more about the healthcare system and how we fit in, and maybe give you some case examples on the next video, but we'll leave it at that for now.